Hello and welcome. Today, we're diving into the complex world of multiple sclerosis, or MS. We'll explore what it is, what causes it, how it affects the body, and the current approaches to managing this challenging condition. The exact cause of MS remains a mystery, but it's believed to be a combination of genetic predisposition and environmental factors. It's not directly inherited, meaning you won't necessarily get it if your parent has it. Research suggests that certain genes can increase susceptibility, but environmental triggers like viral infections, vitamin D deficiency, and smoking likely play a crucial role in initiating the disease process. At its core, MS is an autoimmune disorder. This means the body's own immune system mistakenly attacks the myelin sheath, which is a protective covering that surrounds nerve fibers in the brain and spinal cord. When myelin is damaged, it's called demyelination. This damage disrupts the flow of electrical signals between the brain and other parts of the body, leading to a wide range of neurological symptoms. Over time, repeated attacks can lead to permanent nerve damage and scarring, or sclerosis, which gives the disease its name. MS affects people worldwide, but its prevalence varies geographically. It's more common in regions further away from the equator, suggesting a link to sunlight exposure and vitamin D production. Women are also diagnosed with MS more often than men, with a ratio of about 3:1. The typical age of onset is between 20 and 50 years old, although it can occur in younger children and older adults as well. The signs and symptoms of MS are incredibly diverse, depending on which areas of the central nervous system are affected. Some common symptoms include fatigue, numbness and tingling, muscle weakness or stiffness, vision problems such as blurred vision or double vision, difficulty with balance and coordination, speech problems, and bladder or bowel dysfunction. Because the symptoms can vary so much, MS is often called the snowflake disease, as no two people experience it exactly the same way. Diagnosing MS can be a challenging process. There is no single test that can definitively confirm the diagnosis. Instead, doctors rely on a combination of factors, including a thorough neurological examination, a detailed medical history, and diagnostic tests such as magnetic resonance imaging, or MRI, to look for lesions in the brain and spinal cord. Evoked potential studies, which measure the electrical activity of the brain in response to stimuli, and a spinal tap, also known as a lumbar puncture, to analyze cerebrospinal fluid for specific markers of MS. MS is typically classified into several forms based on the disease's course and progression. Relapsing remitting MS, or RMS, is the most common type. It's characterized by clearly defined relapses or attacks, followed by periods of remission when symptoms improve or disappear entirely. Secondary progressive MS, or SPS, often develops after RMS, where the disease gradually progresses with or without relapses. Primary progressive MS, or PPS, is characterized by a gradual worsening of neurological function from the onset of the disease, without distinct relapses or remissions. Finally, progressive relapsing MS, or PRMS, is a rare form characterized by a steady progression of the disease from the beginning, along with acute relapses with or without recovery. While there is currently no cure for MS, there are numerous treatments available to manage the disease and improve quality of life. Disease-modifying therapies, or DMTs, are designed to slow the progression of the disease and reduce the frequency and severity of relapses. These medications work by suppressing the immune system's attack on the myelin sheath. Other treatments focus on managing specific symptoms, such as fatigue, pain spasticity, and bladder dysfunction. Physical therapy, occupational therapy, and speech therapy can also play an important role in helping people with MS maintain their independence and function. Unfortunately, there's no definitive way to prevent MS, given the lack of understanding of the exact cause. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, may help reduce the risk. Furthermore, ensuring sufficient vitamin D levels, either through sunlight exposure or supplementation, is often recommended. The prognosis for MS varies greatly from person to person. Some individuals experience mild symptoms and live relatively normal lives, while others experience more severe disability. Factors that can influence the prognosis include the type of MS, the age of onset, the initial symptoms, and the response to treatment. Ongoing research is focused on developing new and more effective treatments, including stem cell therapies and targeted immunotherapies, with the goal of ultimately finding a cure for this complex and challenging disease. Thank you for joining us on this journey to understanding multiple sclerosis.